Premature infants. Definition. A preterm infant is one who is born before 37 weeks of gestation. At this stage, various body systems are still immature, especially the respiratory system. As a result, preterm infants are at high risk of developing severe complications that can affect their ability to breathe and adapt to the external environment. Guidelines for the care of preterm infants. 1. Temperature regulation. The infant's body temperature should be maintained within the normal range. Rectal temperature should be approximately 37 degrees Celsius. The room temperature in the neonatal intensive care unit, NICU, should be kept between 26 to 28 degrees Celsius, and a room thermometer should be installed and monitored continuously. 2. Respiratory support. As the lungs of preterm infants are underdeveloped, respiratory support may be necessary. This may include intubation or non-invasive support, depending on the specific condition and severity in each case. 3. Infection prevention. Due to an immature immune system, preterm infants are more susceptible to infections. Infection control measures in the NICU include preventing outside air from entering the room, using sterilized individual equipment, and mandatory handwashing before and after contact with the infant. 4. Breastfeeding and fluid management. Breast milk promotes bonding and helps prevent infections. If the infant cannot begin feeding within 4 hours of birth, fluids and nutrients must be provided intravenously. 5. Specific medical treatments. Infants with jaundice require phototherapy. Infants at risk of infection must receive antibiotics. Infants with anemia should receive blood transfusions or blood components. 6. Promoting mother-infant bonding. Avoid unnecessary separation of the mother and infant. Encourage the mother's involvement in care through regular visits, talking, touching, and expressing breast milk consistently. 7. Developmental care. Control light exposure by dimming lights or covering incubators, reduce noise in the unit, and position the infant in a way that mimics the intrauterine environment. 8. Follow-up appointments. Infants should be brought to the doctor as scheduled. Parents should prepare any questions or concerns to discuss during the next visit. Warning signs requiring immediate medical attention. Excessive coughing, thick mucus or nasal congestion, labored breathing, grunting, or fatigue. Very cold or hot body temperature should remain between 36.5 to 37.5 degrees Celsius, cyanosis or darkened skin, increasing jaundice, lethargy, or refusal to feed, seizures, stiffening, or twitching, abdominal bloating, excessive vomiting, or bile-stained, yellow-green vomit, watery stool with mucus or blood, swollen, red, or sticky eyes, foul-smelling, red, or swollen umbilical area.